Hi, everybody. This is Dr. Brett Talley Daniel, MD, and I'm a neurologist and a headache doctor. And today I'll be discussing, does pseudoephedrine work for migraine? Pseudo means false or untrue, as in pseudo-intellectual, a name for someone who's really not very smart. The EPHED, ephed part of the word, is taken from the plant ephedra, a naturally occurring alkaloid. It may be spelled as pseudofed, P-S-E-U-D-O-F-E-D, or Sudafed, S-U-D-A-F-E-D. Pseudoephedrine is a mystery drug that confuses people, especially migraineurs. Does pseudoephedrine work for sinus headache, a deceiving term that usually denotes migraine? Does it work for migraine? Pseudoephedrine is medically effective for congestion and wakefulness. It is a weakly effective drug for migraine. There is no sinus headache, an entity which is not listed in the International Classification of Headache Disorders, third version. The phrase, quote-unquote, sinus headache refers to migraine without aura. Pseudoephedrine is a sympathomimetic drug which imitates the effect of the sympathetic nervous system. It is a drug in the amphetamine and phenethylamine chemical classes. It is effective as a nasal sinus decongestant and as a stimulant or a wakefulness-promoting agent in higher doses. It is only weakly effective for migraine. Related questions. Who discovered pseudoephedrine? It was first used in 1889 by the German chemists Ladenburg and Oschlagel. They used a sample that had been isolated from Ephedra vulgaris by the Merck Pharmaceutical Corporation of Darmstadt, Germany. What chemical form of pseudoephedrine is commonly used in medicine? The salts pseudoephedrine hydrochloride and pseudoephedrine sulfate are found in many over-the-counter preparations. They are dosed either alone or packaged with other active drugs such as antihistamines, guaifenesin, detromeforphan, paracetamol, which is acetaminophen, or an NSAID such as aspirin or ibuprofen. What are examples of pseudoephedrine drugs? Pseudoephedrine hydrochloride is a common drug in many over-the-counter sinus medications. Typical examples would be 12-hour cold maximum strength, Biofed, Senefed, chlortrimeton, nasal decongestion, Contact 12-hour, Dimetapp, decongestion, Efidac 24-hour pseudoephedrine, Flixure congestion children's, Genefed, Pediacare decongestant infants, Simply Stuffy, and Sudafed. How does pseudoephedrine work? Pseudoephedrine causes vasoconstriction of the small blood vessels in the nose and nasal sinuses. It acts as a decongestion. The extremely vascular nasal mucosa shrinks in response to this vasoconstricting drug, which opens the nasal passages. The patient breathes again. The advantage of the drug is that it produces a gradual but sustained decongestion effect, causing little rebound congestion. Although it exerts a sympathomimetic effect, it does it indirectly. It's better for the nose to get a decongestion orally through a pill than by directly putting something in the nose, such as Afrin nasal spray, which typically causes decongestant rebound if used more than a few days. Pseudoephedrine side effects. Pseudoephedrine has rather common and unwanted side effects. These are mainly listed on the bottle in small print. With continued use, and especially at high doses, tolerance to the medication develops, and the user increases the dosage. Toxic signs and symptoms then may occur. Common adverse drug reactions associated with pseudoephedrine therapy include central nervous system stimulation, insomnia, nervousness, excitability, dizziness, and anxiety. Infrequent side effects include tachycardia and palpitations. Rarely, pseudoephedrine therapy may be associated with mydriasis, which means dilated pupils, hallucinations, arrhythmias, hypertension, seizures, and ischemic colitis, as well as severe skin reactions known as recurrent pseudoscarlatina, systemic contact dermatitis, and non-pigmenting fixed drug eruption. Pseudoephedrine, particularly when combined with other drugs, including narcotics, may also play a role in the precipitation of episodes of paranoid psychosis. It's also been reported that pseudoephedrine, among other sympathomimetic agents, may be associated with the occurrence of stroke. Pseudoephedrine precautions and contraindications. Pseudoephedrine is contraindicated in patients with diabetes, mellitus, cardiovascular disease, severe or uncontrolled hypertension, severe coronary artery disease, prostatic hypertrophy, hyperthyroidism, closed-angle glaucoma, or by pregnant women. The safety and effectiveness of nasal decongestant use in children is unclear. Pseudoephedrine can aggravate other neurologic symptoms. Another problem exists for anxious or panic attack patients who may become more agitated on a pseudoephed, which acts a lot of ways like caffeine. Patients with tremor, either Parkinson's disease or essential tremor, may find their shaking is worse if they take pseudoephed. Pseudoephedrine interactions, concomitant or recent, that is 14 previous day of monoamine oxidase inhibitor use, can lead to hypertensive reactions, including hypertensive crises. The antihypertensive effect of methyl-dopa, mecalamine, reserpine, and baratrum alkaloids may be reduced by sympathomimetics. Beta-adrenergic antagonists may also interact with sympathomimetics. Increase of ectopic pacemaker activity can occur when pseudoephedrine is used concomitantly with digitalis. Antacids increase the rate of pseudoephedrine absorption, while kaolin decreases it. Accidental dosing of pseudoephedrine. Pseudoephedrine is often appended to an antihistamine medication. It is the D or decongestant in drugs like Claritin, like that's called loratadine D. The antihistamine works on the altered immune function, relieving the allergy symptoms, and the decongestant pseudoephedrine causes nasal arterial constriction. The side effect surprises some people who don't realize what their doctor has ordered, and they find that they can sleep just fine on plain Claritin, loratadine, but they can't when they get Claritin or loratadine D. Does pseudoephedrine help sinus headache? Patients with so-called sinus headache may find that their headaches get better after they've taken over-the-counter medication, which contains a painkiller and pseudoephedrine. The true story is their migraine headache caused by vasodilatation of arteries in the brain is better following the vasoconstrictor effect of pseudoephedrine. However, pseudoephedrine treatment for a sinus headache, migraine, is not as effective as using a triptan drug at onset, which can give the patient a headache-free time in 2 hours. Pseudoephedrine treatment for migraine usually doesn't make the patient headache-free. The dark, stormy side of using pseudoephedrine. Pseudoephedrine has a stormy side also. It's been on FDA newsletter alerts sent to physicians warning of its habituating qualities. Drug addicts operating home meth labs often buy up large doses of pseudoephed and then change it to methamphetamine, a structurally similar chemical. The pseudoephed industry has misled the American population since the 1950s with TV ads on sinus headache on TV. The International Classification of Headache Disorders doesn't recognize sinus headache, which is usually migraine. Read my article on sinus headache at www.drmigraine.com to learn more about that. So this is the end of my talk on this, pseudoephedrine for migraine. Does it help? Please subscribe down there so we can follow each other. Thank you for listening to this. Look for me on podcasts on migraine, on other sources. God bless all you people who have migraine and sinus disease, and I will see you on the next talk.